So you decided to pursue the PhD in interdisciplinary aging, mostly because you saw that interdisciplinary aspect of it. But then you open up this podcast saying that you're a gerontologist and a meta gerontologist.
Yeah.
What were some of those big learnings that you gained throughout this program, and how did you grow into like that aging studies part of the work?
When I saw Tulane come out with that program, it was just in time. I was in the middle of my master's program when they did it, and I ended up matriculating into the second class of that program. And it was just in time for me, because I knew that I wanted to do an international placement, and the person who helped us with that, pick a certain place, was I told them, hey, I'm now exploring aging. Can you place me somewhere that focuses on older adults? And so they did. And like I said, it was an interdisciplinary part that caught me. And so I had that experience in India where I interned with an organization that serves older adults. I started reading more books on aging. And then I was thinking to myself, and I got more interested in it. And I was thinking to myself, if aging is something that encourages interdisciplinary thinking, and I really like interdisciplinary thinking, then this is probably something that I should go toward and pursue. And I've just become more and more interested in it, obviously. And aging is universal, right? Time moves only forward for us. As soon as you're born, you start getting older, and that happens for everyone. The only kind of experience with life that is more universal than aging is death, and aging is the step before that. So, I think that despite the fact that it's something that everyone can relate to, of all the different kinds of isms that you can think of and phobias, homophobia, racism, sexism, ableism, etc., I think the data would back me up on this, that ageism is the one that gets a lot less attention. And I'm not, all those issues deserve a lot of attention, but as a gerontologist, I'm definitely going to focus on ageism. And, I think we have a long way to go. Demographically, tons of people are getting old, but we are not a society that is very good at facing that reality. We need to be a lot better. So, the more I learned about it, the more interesting it became. And now it's me. That's what I am.
Yeah, I appreciate that. And I'm going to butcher the stat, but I definitely saw a stat recently that by 2034, I think the majority of people in the US are going to be above 65 or
Yep.
some sort of derivation of that stat. Just saying that a lot of our population is going to be aged, like a high population, a high amount of the population is going to be of that older
Yep.
age group. So how are we thinking about solutions for those groups?
I know, and there's no social, political, economic, cultural, or epidemiological or demographic reality that is separate from or independent of that fact. Everything is tied to that, and it's going to be a foundation of what our country is going to look like moving forward. That and I don't remember the year, the 2040s maybe, where whites will not be the largest majority. So, population aging, immigration, and these different demographic and epidemiological transition, it's easy to connect they're all connected to one another. A joke that I did with my students was, I don't know if you've ever heard of the game 6 Degrees of Kevin Bacon. You connect any movie within 6 degrees to Kevin Bacon because he's been in a lot of movies. So I would joke with my students, let's do the 6 degrees of aging. Give me any issue at all, and I can connect that within 6 degrees to how this is related to aging. So that's where we are right now. I could go on for hours talking to you. You could throw any social issue out at me right now, and it's so easy to think about how that's tied to aging, right? So yeah, that's our reality, and we're headed where you just said, but somewhere I think it is sometime in the 30s where the majority will be over 65, but we are not equipped to handle that right now.
What is it that people get wrong about gerontology or aging populations?
Well, I'll focus here on the U.S. in particular. We have by far the highest healthcare expenditure than any other country in the world. It's not even remotely close. But we have some of the worst health outcomes among industrialized countries. First of all, we should be absolutely embarrassed about that fact. That's embarrassing. Our healthcare is incredibly inefficient. We do not get the best bang for our healthcare buck. A large percentage of those healthcare dollars are spent in older age, especially in the last 2, 5, 10 years of life. We just spend way too much money. It just doesn't have to be this way. And it's not, lifespan's not the only important thing here. Health span is important. So many people have told me when they find out that I'm a gerontologist, like, oh, you're trying to figure out how to get us to live longer. And I'm like, wait, you don't want to just live longer. You don't want to live until you're 90, but 30 of those years you're sick and have disability. Our health span also matters, and we're lagging behind when it comes to that. We're lagging way behind. Remind me what your question was. I got off talking.
What do people get wrong about
aging?
Yeah.
Mm-hmm. Yeah. I think that there are a lot of things about this country that has not set us up well before we ever anticipated of having this kind of population aging. That has not set us up well for success in that regard, and that's true at kind of the national policy level. At the individual level, like I already mentioned earlier, we're just not good at planning ahead. People don't want to talk about their own mortality. As counterintuitive as it may sound, I actually think that the more we brace our own mortality, the higher our quantity and quality of life will be. But we just don't want to talk about that. We don't want to get life insurance. We don't want to go ahead and put some money aside to plan for our funeral and whatnot, so our children don't have to worry about that. We need to get better at having those conversations. I think that we are, but we'll have to see how your and my generation does better when we are in older age, right? Maybe things are getting better, but those are some things that we just don't do well. And aging is extremely gendered as well. It's very, very gendered. That's a whole other conversation. But anyway, we got to get better.
Appreciate you sharing that. You were also a guest professor at China University of Political Science and Law. Tell us about that experience.
It was when I was in the PhD program. One of the members of my dissertation committee was a Chinese woman, and she was in the School of Social Work, and she just approached me one day and was like, hey, Jacob, would you be interested in going for the summer to teach a couple of guest courses in Beijing? I'm like, hell yeah. I had already been to Beijing previously once, but this is a good opportunity. And it's a good thing I did it. It's the only teaching experience that I had before I landed my first job as a professor right after the PhD program. So it's a good thing that I did that. And it's China is an interesting country for just about every reason. It differs. Let me think of how to say this. The ways that the US and China are different are just as remarkable as the ways that we are similar. Mm-hmm. Teaching, being in a university setting in a country where Marxism is the foundation rather than Western thought, like it is for us, it's very different. And I had a lot of interesting conversations. Social work there, it's more so that Chinese, if I understand this correctly, I guess there's less latitude for many Chinese people to choose their careers. And so a lot of people were sitting in the social work class and they didn't really love the idea of being social workers. I don't remember the full details. It's just really interesting. It's an interesting place to teach. I'm glad I had the opportunity. In every single place that I've been to, including there, in every single experience I've had abroad, I've learned at least as much as from them as they did from me. So that's definitely true in this case.
Well, it seems like it's definitely a rewarding experience in of just that. If it's just that you're getting it, so that's awesome.
Yeah,